Hi, this is Rufus again, and this is 1 year after my surgery video, just to talk about my experiences with my recovery, some thoughts about my opinion about the surgery, and some more information about some training for, I guess, the recovery process, and talk to you about the cochlear Baja device that I also got installed in my head to help with the hearing, that I have now hearing loss or completely deaf in my right ear. So as far as my recovery, my facial movements, if I lift my eyebrows, I still cannot lift the one on this side, but if I were to try and push downward, I am getting a little movement out of here, where 3 months ago I had no movement at all. So that's looking good. My smile is still very weak here, but I do have the movement of my cheek, and of course whenever I try to smile, my eye squeezes, and if I squeeze my eye, my smile comes. You're basically, with the nerve damage, I forget what the word is, but they're kind of firing all together. So that's part of the training. I'll try and get back with you later on trying to work with that. But as far as the surgery, for all you out there who are just found out you have an acoustic neuroma, please do your research. A year ago, I did not have all the information that's available now on YouTube. There is an interesting video of the actual surgery. It goes from beginning, pointing out the acoustic neuroma, to them dissecting it and showing the facial nerve and what is actually done. I did not have that video. That video is actually published 9 days after my surgery. So I just noticed it today, and the date, because I was saying I didn't see that video before, and it was published 9 days after my surgery, which was a year ago. So it's very informative, it's very interesting, it's very like, wow, I can't believe I went through that, or for you out there who may go through it, you know, kind of, wow, that's intense. But you can live through it. If you have to have it, and it's just no turning back, don't worry, you're going to live. It's going to be painful. The drugs, the medications are the worst part. They make you feel like crap. So the quickest you can get off those things, the quicker you'll feel like you're getting back to normal. The medications throw off your smell, throw off your taste. They make you feel dead. So for the first 2-3 weeks out of the hospital, it's going to be the medications that are the worst thing. Even though they're to take away the pain, sometimes if you get off them and deal with the pain, you'll feel like a human, you know, instead of a zombie. So I'm trying to think of everything so quickly for this video, so please bear with me. The surgery I had, it's a Baja implant. This is the little box you'll get if you go through that portion of the surgery, and I will talk about that specifically in another video, because I want to try and make this video short, a little shorter. This is the actual Baja device, just in case you don't check out the other video. And this is the implant. It's a screw that's bone anchored into my skull, right there. And it's a little swollen today. I don't know why. I went for a bike ride today, a long bike ride, so I don't know if that irritated it with sweat. But other than that, I'm trying to think.
Nerve damage.
Oh, nerve damage, yes. With the screw implant, I now have numbness in this portion. And it's kind of like a super sensitive, numb feeling. The downside of it is it feels super sensitive and numb, but the upside is it's consistent and whenever my wife rubs my head right here, it just makes me fall asleep. Like, it feels so good just to do that. It just feels really good. So I can't say I don't like it, and I can't say I do. It's kind of goes both ways. Other than that, some more of my facial, my smile, my frown, eyebrows. You just got to really try to control it. But that's that. And one more thing, my doctors told me that before I had the surgery, they said, you're looking at about 6 months to a year until you get back to normal. And I guess the word was used, normal. So I was thinking, hey, may suffer for a year, and I was thinking I was gonna recover super quick. I'm some kind of Superman or something that, I'm gonna get through this recovery maybe 4 months instead of 6 months, kind of thing. But it's not like that. It takes time. We're not superheroes. This isn't, it makes you realize that you're human, and it makes reality really settle down to what time it takes to heal. So they told me 6 months to 1 year before I become normal. Well, obviously I'm not normal, and you won't be normal. There's a few cases that you may be normal based on the size of your tumor. But in my case, I had a 2 centimeter, and the damage was done to my facial nerve, and my nerve is fighting to grow back right now. I think they told me it grows 1 millimeter a day. So if there's so many millimeters going to the points in my head, it takes up to about a year, to kind of get all that growth back. But I'm at a year, and I still don't have a lot. So I'm pretty much probably going to stay like this, and maybe the muscles that are working will get stronger. But my facial therapist said she's looking to get me hopefully at 85%, which I'm at 56 right now. So 56% movement, going to 80, 85 is good, but never expect to be completely 100%. So I just want y'all to know that, because I felt like I didn't know that, and I thought I was going to be 100% one day. So just so you know, ask your doctors, look on YouTube, look at all the surgeries out there, and you'll see that people still have the paralysis. And if you're not okay with that, look at your options. Usually the option is you have to have the surgery, so just so you know, life goes on, you can get through it. And I hope my other videos talking about the facial nerves, I'm going to talk about that in my next video. And also, that's the recovery and the treatment. And then also the Baha device on how it's working for me. So, hope this helps. Email me if y'all have any questions. And this is 1 year after my surgery. I feel good. Looking for this next year of stronger muscles and see if I can get to that 85%. Thank you.